Hello, I'm Brian Kugel, and I'm here with Sean LaFrance. We are both members for a long time of the New Hampshire Healthcare Decisions Coalition. Sean, in fact, began that coalition and is the founder of that coalition. And we want to take advantage of our time together to talk a little bit about the history of POLST in New Hampshire. And Sean, I'm wondering when you first heard of POLST and brought it to the table.
I heard about POLST when we were starting to think about creating a DNR order that would be portable in New Hampshire. And this is back in the 1990s. And what we realized is through a difficult circumstance at one of our hospitals that a patient, when they moved from one place to another, their request for DNR was not honored in transport and not necessarily at the other place, because a doctor may have signed it who was not on the medical staff of the receiving institution. So we dug deep into understanding how that was working in other states, and in the process found out that in the state of Oregon, POLST had been established there, and that took it, the portable DNR order, to a much higher level in terms of choices that could be written on this portable order.
Right. A lot more options were considered and decided upon, and then presumably would be honored.
Right. It was questions like do not hospitalize and other types of particular treatments are included in the POLST form.
Right. Well, I do remember though that the decision to pursue or to not pursue POLST as a piece of legislation was a difficult one for our coalition.
Right. There were some healthcare providers who work with patients near the end of life in hospice care, etc., who felt that as they became familiar with the POLST form, we should really just focus on setting in law the POLST form in New Hampshire, and DNR's embedded in that, and we wouldn't have to just have a portable DNR law.
Yeah, but I do remember other people in the medical realm, people, members of our coalition and who consulted through our coalition, fearing that the non-specialists particularly would then just avoid DNR orders altogether if it required that many discussions and decisions. And there was a fear that any form that was only partially completed in a hospital environment would be regarded as an invalid form. And that was not a matter of helping, that was a matter of making things worse. So.
Right. The goal around POLST at that point, I think many people agreed upon, but as you said, the complexity or the added questions on a POLST form would require a much deeper educational and practice change within healthcare and medicine. And also, we knew that by introducing the portable DNR, that literally thousands of EMS, emergency medical technicians across the state, would have to be trained to understand what that is and to be able to use it or honor it for the people that they're moving around in their ambulances. And that takes time to do that kind of a change.
Yeah. So the coalition then was successful in introducing legislation that allowed for a DNR to be portable in the state of New Hampshire, and then set about trying to promote and familiarize the medical establishment with POLST and its value, used POLST, arranged POLST forms to comply with the portable DNR requirements in the state of New Hampshire. And up until 2021, POLST existed as a practice standard rather than a device defined by law. Now it is mentioned in the statute as one of the ways in which a portable DNR can be expressed and should be honored.
Right, and the important thing there is by referencing it in the law the way we do now with the 2021 change, it still allows flexibility because, again, once a form is put into the statute, as was thought back then, that creates a lot more challenge if it turns out to not quite be clear to the people who want it or the people who need the medical people who write the orders.
We've decided as a coalition that New Hampshire should adopt the national form, which has recently been composed. And my colleagues in other states have a difficult time because in some states, the legislature has defined what are the ingredients and the components of the POLST form. And that means they have to get a friendly legislature to go line by line in agreement with the national POLST form. That's pretty hard.
Right, and all of the changing these laws and advance directives are always a challenge, and that level of detail on a form, I'm really grateful that the coalition decided not to go down that path, because we have established a standard of practice with POLST and an awareness of it, and we're still able to adapt because with all of these laws, the science and knowledge and societal expectations change.
Yeah. Well, Sean, thanks for joining us. Thanks for our discussion today, and thanks for all the work you've done.
Yeah, well, thank you, Brian, for continuing to carry the flag for
All right.
our state.
Take
Thank
care
you.
then.
So,
Do that.